Establishing pelvic floor awareness is really important for one, just like preventative, just knowing how to use those muscles is super important, but also it is crucial for working on any diagnosis of the pelvic floor, whether it's pressure management during pregnancy, whether it is working on resolving incontinence, prolapse issues. It all really comes down to, again, the pressure management in pelvic floor and understanding what the pelvic floor is doing, how it's moving, and how it moves in relation to the activities that we do. Now, it can be really tricky initially to figure out what your pelvic floor is even doing, right? Like, it's a muscle group of muscles that we cannot see, right? Like, it's easy for someone to show me how to do a bicep curl where I'm contracting that muscle and lengthening that muscle. But if somebody's telling me, hey, I'm doing a pelvic floor contraction, I can't see it, I can't feel it, I don't quite understand. And so practice is going to be really important. Now, when we inhale, we think about the diaphragm's on top here, our muscle of breathing, and then our pelvic floor is on the bottom. When we take a good deep breath in and really work on expanding in a 360-degree manner, a bit from the chest and belly, a lot from the rib cage and through our back, what should happen is the pelvic floor will descend on that inhalation, and then it recoils on an exhalation. Now, if I choose to, for whatever reason, perform a pelvic floor contraction, then it's going to contract. But for this purpose, we really want to be able to feel, can my pelvic floor relax and can it just recoil back to its original position? So I like to use cues. Again, we can't see our pelvic floor. So I like to use my hand, or you can sit on a physio ball and use a ball instead. And you can place your hand like on your perineum, right? So like you can actually feel and palpate. You can also roll up a towel roll and sit on a towel just so it gives you a little cue. But again, as long as you feel comfortable and you're in a space where you can do this, you can sit on your perineum and again, think about breathing in that 360 manner. You may have to close your eyes for this one. Really focus on what's happening at your pelvic floor. But what you should feel, maybe not right away, but over time, once you practice this and practice your breathing, the pelvic floor should gently lengthen or relax down, and then again, recoil back to its original position. So give this a try. It is really the foundation, what we call the low-hanging fruit, that's really going to move the needle forward for all the other things that we are going to do and talk about.